Hello everyone, and welcome to SoftFil Academy's live masterclass. We are very happy to welcome everyone. Welcome first to Dr. Francesco Marchetti. We are very happy to do this first webinar. It's your first webinar with SoftFil Academy, so we are very glad to welcome you and also to welcome you as part of the SoftFil Academy family.
Thank you. I'm really honored and more than happy to join the Academy, to join the SoftFil family, and let's see what's next.
Great. So tonight's webinar is being recorded and it will be on SoftFil Academy's platform from tomorrow. It will also be on our YouTube page, so don't worry if you miss any parts. It will be live from tomorrow. You can rewatch it as much as you want. Can you go to the next slide, please? So tonight's theme is the body injections using cannulas. As you know, SoftFil developed a new range of cannulas, especially for body injections. So tonight, Dr. Marchetti is going to deal especially with three zones: the buttocks, the hands, and the calves. Dr. Francesco Marchetti is a plastic and reconstructive surgeon from Italy. He works especially in Rome, Milan, and in Doha in Qatar. So I will now let Dr. Marchetti start the webinar. Please wait until the end of the webinar for all of your questions. You can ask anything during the webinar in the chat part or the Q&R part, but we will answer everything at the end of the presentation. Thank you so much. I hope you will learn a lot tonight, and we will talk more at the end of the webinar.
Thank you, Anna, for your amazing presentation and your amazing welcome. I'm really happy to start this new webinar. For me, it's the first time, but we will talk about something I used to talk for maybe 10 years, maybe between 8 and 10 years. This is a really a new option for the face, but cannulas will always be the best option for if we are talking about body treatments. Cannulas could be not only for fillers, could be also when we injected the fat, and SoftFil cannula could be really the best option also if we are injecting the fat. For sure, we have to differ between, as we see in the slide, between the cannula and the needle. Needle, if we are talking about body, is really not the best option. Why? Because of the sharp and the tip that sometimes, if we are injecting, for example, in the buttock, we could not be so safe because we can inject inside the muscle, and injecting inside the muscle, as regarding the fat, we know that the FDA stopped to inject, to suggest injecting in the fat because of the microembolism. That's the same with the hyaluronic acid. So cannula could be, above all for the blunt tip and for the flexibility, amazing and safer. We just need one entry point with the cannula. Usually, if we are talking about buttock, we share with colleagues our technique of tridimensional, so we can decide to inject between 2 and 3 entry points, but it's not for sure the multiple entry points that we could need with a needle. The range of cannula, we know it's really wide, but as regard the body range, we can focus on 2 or 3 points. That is the 16G, the 18G, and the 20G. If we are talking about ends, we can use between the 18G and the 20G. What differ really from the other part of the body is that we can choose a smaller length, because we can choose the 70 millimeters instead of calves and buttock, or sometimes also some body defects in contouring or like post-lipo defects. We suggest to use longer cannula, like the 90G cannula, because it's still not so much flexible, so you can reach also the farthest point with the same accuracy and with the same safety. The range of the cannula fits really for every zone and for every filler type. We are talking here about fillers that usually is hyaluronic acid, but we can also use this kind of cannulas also for the polylactic, just around the body. It's really big also, the diversity, as I told you before. And above all, also the design is to give to us as a doctor the more safety that you can. The tip is really rounded, so it's really safe because we don't risk to inject, at least in any vessel. The area that we are treating when we are treating the body is quite safe. If we are talking about the buttock, it's really, really difficult to inject inside some vessel, because we have not any big vessel in the soft tissue layer. That is, the deep soft tissue is the tissue where we have to inject when we inject the buttock. And also the graduated design, more precision when we decide how far we are going to inject. Today's the cannula are sold in usually in boxes with 20 cannulas with pre-rolled needles that are really designed to fit with the cannula we are using. For the body, as I told you, this is the range that we use. Sometimes, and someone could use also the 14G. I use the 14G for the fat, not for the fillers or for light treatment, because usually sometimes 14G could be really a little bit too wide. It's really important for the body filler because of the thickness of the body filler, the lower lock base, because the body filler sometimes could have a bit of strain when we inject, but with the lower lock base we are super safe that we can inject, to avoiding the resistance and avoiding to spread the product out of our injection and between the syringe and the cannula. Usually here we have a slide where we summarize which is the best cannula we are injecting. We are now doing with bioscience a new study on the feet, so we will use also on maybe the 23 or the 20 with the softer filler. The tissue depth and above all the quality of the tissue is really important while we are injecting inside the body, because the layer that we have to reach, it's always adipose tissues. Also, when we inject in the end, that we know that we don't have any big adipose tissues, is always deep subdermal. It's really, really important. We are talking always over the muscular fascia. The injection is always over the muscular fascia. The cannula for body contouring is really useful for the volume enhancing, for skin remodeling, if we are talking about cellulite sometimes, and also for skin laxity. That usually is done like a second or third step or treatment when we are volumizing or reshaping in buttock, calves, concavities. We can treat, and this kind of cannula is really super have an high performance, above all also for scars, where we see that also with hyaluronic acid, we could have really an amazing improvement while injecting for the biostimulation of the hyaluronic acid. Today, we assist really an increase in the number of requests of the body enlargement because we have this new tool that are fillers, because in the past, we know that we have just two options, that is the surgery and the sometimes the fat. Between this option, the body filler and above all the HA is really different because it's an office procedure. We don't need to use a big quantity or big amount of anesthesia. It's for sure really less invasive than surgery. And maybe if we are talking about the possible complication that we could have with implants, is we can say that it's also safer than surgery. For sure, the difference between surgery and injection in aesthetic medicine is the smaller learning curve, because if we are talking about implants in buttock or implants in the calves, is one of the most difficult area to treat with implants, and usually surgeon requires really an extensive experience, while we are starting to do by ourselves this kind of peculiar surgery. Is not we're talking about the HA, we are talking about the filler, so we are talking about something non-permanent that is also this really safer. The recovery is super fast, as we will see later. We will have a really minor downtime if we are compared to surgery, with minor touch-up. We will have between calves and buttock different need of touch-up. The touch-up, the most important number of touch-up usually is when we are talking about buttock. But in calves and hands, usually we could have just a little or a light touch-up after a month. As I told you, this is the difference between the filler and surgery. What I want to underline is that the learning curve is really, really less high than what we have in the surgery. Yeah, if we compare the cost ratio between the cost and benefits, maybe filler could be a little bit higher, but with the new kind of filler, especially the HA, we are talking about macromolecules instead of micromolecules that we use for the face. We have a really long-lasting result that could last at least up to 2 years. The HA benefits, as I told you before, is between all these characteristics is I want to underline the fast healing. So we are talking about the minimal trauma, and the minimal trauma is really linked also to the use of the cannulas, because instead of multiple entry point with the needle, and instead of the sharp tip, with the blunt tip, we don't have, because we arrive really very easily with the needle for the entry point. With the cannula, we arrive really easy in the safe and in the precise layer that we have to inject. So the trauma between, swelling and bruising will be really, really reduced. This is a repeatable procedure. You will see, and you will adjust the volume and the reshaping as long as the patient and the doctor desire. And also hyaluronic acid could give us a moisturizing effect. The techniques is really important, so it's really linked to, for sure, the skills of the doctor, but a lot also on the tool we will choose. If we choose this kind of cannulas, we could be really sure that we will avoid also a fast resorption,